Today we're going to demonstrate an interesting case. This is a patient came in with a tibial shaft fracture. They'd had a nail placed at outside facility, but also an MRI previously, which demonstrated a complete tear of the ACL. So we decided to perform an ACL repair, as this was the only option with a nail in place, and the nail could not be removed till full healing had occurred. So you can see here the nail placement. So obviously the attempted repair is a great option here if we can save it. So we're going to prepare the ACL. A key here is obviously doing the internal brace. You have to avoid the nail. So the technique is a little bit different. So here first we're going to microfracture the notch, and this will prepare the e-growth of stem cells into the ACL repair. And you can see the vascularity is quite good here. These are 25 millimeter fiber rings. We want to prevent slipping, and also the size of the ACL warranted the 25 millimeters. And now we've done that first to check the tissue, and then we're going to use our bowl guide. Now you can see we come out slightly more medial. This was again to avoid the nail. Actually, the first attempt we hit the nail, so we had to slightly veer more medially. And then we're going to place the spade tip, and this is going to be drilling our femur. We go back and forth on the femoral cortex just to make sure the button goes in smoothly. We have our passing stitch here, which we're going to pull out the lateral portal. In the medial portal, we have the passport cannula. And now what we're going to do is engage 1, 2, and 3 of the ACL Repair TightRope. You can see this is essentially like a BTB TightRope. And then we're going to engage the second fiber ring, and we're going to make sure these slide nicely, which you can see they do in this case. And then we're going to pull the femoral stitch to pull the button up into the femoral cortex. You can see here we're holding back tension. You can watch my previous videos on how we do this. And then we're going to slowly pull this up. We're holding on to the internal brace so that it does not pull into the IT band. Once this button is flipped, then we're going to slowly tension the white TightRope sutures. You can see here that they pull up smoothly. Again, you want to have some tight tension on the ACL, but you do not need to go full tension until you've completed the internal brace. Now we're going to pull the internal brace down into the tunnel. You can see here the placement's still pretty good even with that nail in the way. And then you can see here there's incredible vascularity of this ACL, so I feel really good about this option. You can see the lockment is completely returned. And now here we're testing it again, and then we're actually going to probe the ACL. You can see there's really good tension on that ACL, and you can see all the vascularity of this ACL. So this is a very good prognosis for this patient. And again, we did wait for some removal of stiffness from the previous nail, which had been done about 11 weeks prior. Thank you.